Great. Thank you very much. Now I'd like everybody to imagine for a minute that having heard these great presentations, that you are about to design a building, and you can have whoever you want in this audience help you design this building, and you're going to take this to the greatest company you can ever imagine. You're going to say, we are going to design you the best building that ever existed. And you're going to say, I can prove to you that this building is going to make your workers more creative. I can promise you it will make them more productive. Your turnover will decrease. Not just your absenteeism will decrease, but a word I always love that Whitney says, but your presenteeism will increase. People will really be engaged. In fact, I can promise you that they are less likely to sustain a musculoskeletal injury. I can promise you that they will have improved heart function. I can promise you that they are less likely every single year to die. I can promise you all of these things. Would that be powerful? We have the metrics to do just about all of this. We can show that if you climb 7 sets of stairs a day, 7 flights of stairs a day, you are less likely to die. We can promise you that if you work any bone, any joint, any muscle, any tendon, that it is stronger and you're less likely to have a hip fracture. By the way, 25% of people after a hip fracture die within a year. Isn't that powerful? So you've heard ways that you can go out and do this. So far, you've heard a little bit about the metrics, and so perhaps in the discussion, we might want to get a little bit more into the metrics of how do you prove to the person that you're trying to sell your idea to how it's so great. And let's get into some discussion and ask the people up here who can give you those answers. By the way, be thinking about your big idea for ROAR, and we hope it will come from ours.
So I think I have the first question. So Whitney Austin Gray, Canon Design, Georgetown University. So perfect lead-in, Angela, thank you. I want to talk about translation. I want to talk about variability and performance. So one of the big challenges is from the architecture design community is if we do put forward performance metrics, contract is out, we've moved on. It still is the impetus on the design firms often to come back later on to find out if it worked. And even if it did work, and it worked in that community, will it work in another community? And we spoke about variability. We spoke about the difference between occupant needs. We've talked about sensors, individual sensors. Activity-based work environments is a new, dynamic out there. So I want to challenge this panel, because if we are out there in performance metrics, how do we take that forward and actually advise our clients on some of these issues around how we can actually measure and determine that if you invest up front, you are able to get to those end outcomes. I will also put out there, and I will challenge you, it's not for us alone. I wonder who here is workplace health promotion, who here is organizational change management, that's not in the room, that is a critical component, because it's not just enough to build it. We do need to program that space. So I just kind of wanted to some feedback and comments on variability, performance, and translation.
I want to start by just saying I think we have to be really careful about promising any outcomes. So I heard that in both what you both said, and buildings are really complex and people are really complex, and I think we've all gotten ourselves in trouble when we try to assume we know about causality versus association. And I think we definitely need more data. And I think when you use words like more likely, I'm a little bit more comfortable with that. When I hear things about promise, I think you're setting yourself up for failure. So I do think that designers need to spend more time learning about the performance of the buildings that they created so that it can inform future design decisions. But I think we have a cultural problem where we don't invest enough in design and value that process to make it economically viable for them to do so.
And I'd like to second that point and say for the designers that we in the research field who are developing the methods to quantitate and the metrics, as opposed to, you heard from Brian Civic earlier, anecdotal impressions that certain aspects of the physical environment impact health, those of us who are developing these methods are in the design phase of developing the methods. We haven't built the building yet. When I say built the building, I'm using it as a metaphor for having created the methods to actually pull out in real time in complex settings. And you raised the point about using systems methods. We're talking about the same kind of methods that are used to predict the weather. We're not there yet for the built environment. We need to do the research, to develop the methods, to have the quantitative data, to inform the designers to build the buildings that are healthy and support human health and well-being, emotional and physical health.
Over here. Oh, sorry, Charlene.
I want to move this back somewhat. We're focusing somewhat as much on materials as we can on this conference. I understand to push people to move, we want to make the stairs pretty. We want to limit the access to the elevators, et cetera. But what can we do to improve people's movement using different materials? It's a different challenge. I'm going to take the easy answer, and so y'all can do the hard answers. Colors. Colors make people move. They help you, you make it attractive, you're more likely to move. But what other things can we do with materials that will make people want to climb the stairs or do activity?
Well, I think in some of the slides that you saw, a lot of these staircases used glass, and so the transparency and the ability to see your surroundings as you're climbing the stairs is something that invigorates and stimulates people. So to me, that would be an example of a material that could be used to encourage physical activity.
And I would add, what you're looking at through the glass is biophilia, is plants, is greenery. That will engage people to move towards those places.
I love this question, and I think it's something that I think about all the time. And I've been really enjoying looking back at Gibson's ideas about affordances and contingencies, and some of Albert Bandura's ideas about self-efficacy. So I tend to think of action before a product or an object. So what's the intent of the action? And then what's the best tool to promote that action or that response? So an affordance is an idea about responding to visual cues in the environment and how we design small things like grab-and-go cushions. What they feel like, the sensuality of that, I think, promotes a cue that an action is afforded by it being there. You can grab it, you can go, you can move. So that's the way I kind of think about, I don't think about color and materials until way down the line, after thinking about what's the intent of the action and the outcome of that action.
I'd like to stick with that a little bit, and I think many of these questions will probably go toward that direction because that is the intent of this particular panel, to look at the relationship between materials and performance. And examples in our own new hospital expansion, I think, are very intriguing, where we know what colors people move toward. People move toward typically warm colors, move away from cooler colors in general. People might like to follow a path that becomes more narrow, so that's intriguing to us mentally. People like to look through glass, but what is the view that you're designing? Is it a view that someone's going to pull away from, which is going to develop motion in one direction, or toward? So I think these are quite important, but I think that texture is, I won't say underutilized, but we do tend to think of it, especially in a clean, austere hospital space like what I work in. We don't think of texture, yet texture becomes perhaps the most critical input. But one of the things I love in our new expansion is a totally interactive technological material that I hadn't seen until recently, of where it's sort of a Kinect, Xbox-like thing, where there's a wall, an interactive wall, and everything that the child or parent or whatever does in terms of moving, some creature on the wall does the same thing. And so there's a very innovative use of technology, material, motion, and performance, because frankly, these children are coming into the hospital scared to death, and now all of a sudden they've gotten to do something that's going to alter their behavioral approach, to alter their entire approach to everything they see now. So now we've got a whole different layer of how do you interact with what's around you based on something that you saw in a material. And materials, to my mind, include scent, which was brought up. What are all these things? Light, sense, scent, others, all the sensations. And I think we can include those in our discussion of materials as we go through this Q&A.
I wanted to just say something about color, because I think it's totally underutilized as a science. And again, my approach to color is to not think about the color until the very end. So what's the, it's really the effect of light. So color is the science of light. And what's key to those attuning the environments based on visual acuity has to be not only in response to light, artificial and natural, but also cultural affordances and knowing the kind of deeper response to color based on lots of different contexts, including culture. So there is some subjectivity to it, but there's a lot we can do, there's science behind color to make it more impactful.
Question back over here.
Hi, I'm Lorna Rosenberg. I'm with the Environmental Protection Agency out of the Philadelphia Mid-Atlantic office. Actually, I have a question, slightly irrelevant, but is there anybody else in the EPA here where some of my colleagues were supposed to come, and I don't know. I think I'm the only one. Okay, here's my question. For Dina and maybe for Matt, and the other panelists, of course, is that the innovative school that you designed, that I've heard about already a couple of times in Buckingham, was that a public school? Is that a public school? Okay. So the great question is, under what circumstance did this public entity be able to, were they able to, the decision makers able to make the choice for that building? And how can we get other decision makers in other public sector communities able to make broad-minded, understanding, envisioned economic decisions like that for their community?
Okay, I've been called out. So. Hi, everyone. Matt Trowbridge. So I'm very passionate about everything you just said, because I think that's the key point. So let's get right to the really key issue. If you saw pictures of Buckingham, it's very important to note, did not actually add, none of the health promoting features of the building, just like green, have turned out to add any cost to the actual building cost. The building itself had multiple bids, and it came in on budget and on time. So it's very important to make that point. I think one thing that the way you're going to help do this is you're going to have to make, at U.S. Green Building Council, the work I've been doing, at the top of all our whiteboards right now is we're saying, how do we make healthy places investable is really the challenge that's really at our core. And you're going to have to make the health performance of a building transparent so that it can be viewed by the market or viewed by a client, viewed by a superintendent. But I think, so that's one thing. I think really key, though, the key success of Buckingham, and I really want to make sure that we keep this in mind, there was a we successfully made health part of what I would call the design story of the school. So green schools have become very powerful because once everyone gets kind of focused around green, this school is going to be green, then decisions really shift. Because to take away green features out of the building as you come up to inevitable moments of needing to make decisions, they fall away because this is supposed to be a green school. In this case, we said it's supposed to be a green and healthy school. Specifically, we are making a healthy food and physical activity environment. Once you made that, the landscape architects loved this school because usually they don't get to implement their vision until years later, if at all. In this case, to take away the amazing playground structures and take away the school garden would have been completely against the core story of the design from the community's perspective. So it was really, we have to have data, but we have to tell really good stories too, and make it easier for communities to buy in, and then I think we'll come up with very fundamentally different environments. Dina, I don't know if you have anything to add to that.
Before Dina goes, I'm going to bring this up again, Lorna. This is a panel, the second panel this afternoon. So this question. So.
All right, Angela, I think, had a question for you. Yeah, Angela, if we can get a mic over there.
University of Denver. I'm really interested in questions on measurement. Oops, can everybody hear me? Yeah. I'm interested in questions of measurement. So we've talked about the sensory measurement and layering objective measurements in the environment, plus post-occupancy and pre-occupancy surveys. How do you guys see the blending of those two aspects in order to take advantage of some of the insights that architects sort of know holistically? We had a conversation last night about architects sometimes not wanting to measure because this is an artistic endeavor. How do we take that into account and blend those in actual real-world situations? So how do you find out which materials and textures and light and all that stuff will impact health and well-being, knowing and not wanting to have too much participant burden?
So that's exactly what we're developing with our study with the GSA. It's complex because you're dealing with complex variables, and individuals are complex and they vary. All of the different features of the environment, the IEQ that you can measure are complex, and the outcome measures of health and well-being are complex. In our first study that we did, published in 2010, when I was at NIH with the GSA, we were able to detect those two changes on the two measures of the stress response, the hormonal stress response and the heart rate variability. We did not detect a difference in the same subjects in the subjective responses to questionnaires. Now, that may be because it was a small study, or that maybe that people are just not aware of how the built environment impacts their health and well-being, or a combination of the two. So it requires, and as I said before, we're in the design phase of developing these methods. It requires many different disciplines, bioengineers, big data analytics, systems engineers, to develop algorithms. It's just a very complex field, but it's doable. So the good news, as Brian Civic said, is this field in personalized medicine is just, it's moving incredibly fast. Everybody is, walking around wearing something to measure their exercise, their activity, so there are ways to do it. It needs interdisciplinary teams who are willing to learn from each other and create new ways of merging these very complex big data sets.
I wanted to add something to complement the sort of human well-being outcomes that Esther was talking about. There's a resource that's very underutilized, but I think really powerful, called the Performance Measurement Protocols. It was developed by ASHRAE and USGBC, and it talks about how to get into real buildings and look at performance from different attributes, from health, water, energy, thermal, lighting. But what's really nice about it is that every chapter is organized at 3 different levels. So if you just have a couple hours to get into a building, what might you look at? If you have a week, what might you look at? If you're a researcher and you have 6 months to a year, what might you look at? So it was a very collaborative effort. It's a great resource, and I encourage people who are interested in measuring performance of all kinds to check it out.
And I just want to emphasize, I'm not saying we shouldn't do subjective measures. I think what we need to do is merge the wealth and rich qualitative data that comes from subjective measures with the quantitative data and come out with a whole.
This is very much about physical measurements too. So it does do what you do, but it does all the other stuff, and we really need both to have.
One area I think we need to consider in this space is there's been a huge movement to telework. And unless we also incorporate, for the adults at least, if we need to also incorporate trying to understand how that whole change in the work environment is changing people's perspective and their health. Question over here on the right.
Yes. Roar. Anyway, I've been filling out this card like crazy, so I at some point just need to speak up. My name is Dr. Nicholas Watkins. I work for BBH Design, and on the EDRA Board of Directors. But anyhow, what I'm catching a lot of, whether it be materials, whether it be affordances, whether it be self-report or psychophysiological measures is, and being a design researcher in practice, and I experience every day on projects like healthcare projects, is the question, does the process provide value? And is the process incentivized? Now we have certain research instruments at our disposal, all the way from any number of discussed here. However, when I think of a current challenge, we have a lot of standards right now. We think about revising standards and making more points, and that's leading to a lot of very white facilities. And I think in healthcare, it's, especially with HCAPs also now being a standard and whatnot, we're seeing a lot of white rooms. With some ramifications of that, of course, being more light rooms and whatnot, but what does this really do for patients and what have you? And so we tested on a project itself as part of the process, of which is incentivized to help answer the question. And what this kind of gets to, makes me think of, is instead of thinking of revising a checklist or a standard, posing the question that we incentivize a process for the kinds of research that you bring to a project, the kinds of research I bring to a project, the kinds that Whitney bring to a project, and so on and so forth, to help answer a question. So that was just something I wanted to shift our paradigm around a little bit, maybe.
Jim?
I agree.
Oh, go ahead. No, go ahead. I agree. Jim, and then Jonathan, and I think those are going to be the last two questions.
I'm Jim Whitehead. I'm the CEO of the American College of Sports Medicine, one of the collaborators with last year's conference and this one. I want to, first of all, applaud everyone here. I think this is a reflection of a transformative movement to entail really a phenomenal era of progress that's going to have health outcomes, economic outcomes, all kinds of things. Here's the question. It would be for this panel and for all of us. How do we accelerate this in a very intentional way? I mean, there's a lot of things about transdisciplinary teams and transdisciplinary training. Some of that really needs probably to be accelerated, figure out how to do that. And just give you two examples. The Surgeon General's office is going to be releasing a major report next year on walking and walkability. And it really isn't fully connected with the complementary benefits that we're talking about here, where you do one thing right, and it not only helps that one thing that you're intending to do, but multiplier effect on so many other things. And just one other example, the U.S. National Physical Activity Plan, there is one. It's non-governmental, but collaborates with government. National Physical Activity Plan has no dimension of what we're talking about here. And, I know what one of the actions is there. How do we infuse it into that? But I think just a general question, maybe in the Roar session, would be how do we accelerate and elevate these things in a very intentional way? Because we're on to something, obviously, and we need to go faster and have a more profound effect.
So I'd like to respond to that it's true that the first iteration of the Surgeon General's National Prevention Policy strategy focused more on the point that you made. We have been briefing the Surgeon General, the Surgeon General's office, on this very aspect of creating a built environment that enhances health and well-being. And I can tell you that not only personally, but also at the Acting Surgeon General's keynote at Greenbuild, at the American Institute of Architects, Design and Health Summit, and at the American Planning Association, he embraced this concept. So I think you're going to be seeing it rolling out.
Great. He's been at ACSM as well and all kinds of things. We just want to make it even more efficient.
Yep. Jonathan.
Actually, sorry,
last
Angela,
question,
I have
Jonathan.
what I was told would be a 20-second response.
Okay.
It's actually not a response, it's that resource. So here at the NIH, there's something called the Science of Team Science Initiative, and it is focused on how to do transdisciplinary research across all areas. And I don't know if it's been brought into this arena yet, and I'm trying to get Dr. Gray involved in that. And the resource, Dr. Kara Hall, Hall, is the director of the Center for Science for Team Science. She's located at the National Cancer Institute. You can Google her and get her email. And it is a formal NIH initiative that we're investing in, and that may help you.
Thank you. Jonathan.
I'm Jonathan Hers. I'm still at HHS. As far as I know, so far it's well. That's anyway. My question has to do with things that were touched on here, and particularly I think Gail was like rushing to say, just wait a minute here. 15 years ago at GSA, we did a publication talking about the innovative workplace and the strategies to get there. And there are members of the team that we identified who aren't present today, and that's particularly the HR department and the people who make the business decisions. And in my experience as an architect, you can put features in a building, you put fountains in the entrance area to begin to set the tone for the building, and the building manager is looking at his watch and trying to figure out how he's going to convert the fountain into a planter. And on. And that's like the most visible aspect of it, how they're going to start shutting down entrances to buildings because of security so that people no longer have access to a lot of these features. So then they begin to walk by the elevator, things like that. But the biggest thing, to my mind, is there are people still who don't understand that they're part of the process. And my question is, how do you begin to get them integrated into this, but also to understand that they're an essential part of the process, because whatever great ideas, and there are great ideas presented here, are really not going to work unless we get them involved.
I think that's also going right into the next panel. What a great segue. Any comments specifically on that from our group?
I would agree that it needs to happen. I see it rarely, and I think that when the building owner sets out to make a high-performance building, then that requires a more integrated design process, and you see more players coming to the table early in the process, but it's still integration of different professionals and not enough about integration of the users of the building. And I would agree, I think it's really important, and I think you almost need to start with the building owner and to help them understand that the design decisions that are made are going to have a very strong impact on the experience, well-being, and health of the occupants, whether or not they think about it. So they might as well think about it, right? And I would tend to advocate in the programming stage of a building to integrate experiential goals. I call it experiential programming. I get my students to do it. I have the advantage of being able, in a teaching environment, to do whatever I want. But I think paralleling that in a professional environment, that if you set health performance goals early in the process and you use that as your yardstick of are our decisions going to address those, then I think you might have more incentive to get those users involved.
I think if we go back to the very beginning, the more we can tie together the productivity of the space with all the economic factors, Active Earth that Jim Whitehead was talking about and Dave Bassett mentioned, also tie together what the person is doing within the space relative to the economics, the money saved, the increased productivity. And I introduced this panel with, suppose you could promise. We're obviously not there yet. But this conversation is proceeding at such a pace now. Finally, it's really exciting to see all the people in this room involved. So I think that it's only a number of years before we really can make those promises. But that's the challenge today, is to figure out how to do that. And the panel right after lunch is going to be talking about how do you get these decisions to be made. We hope we've piqued your interest in metrics to explore, research capabilities that might exist now, might exist in the future, so that we can get the data to provide the information to the decision makers. And with that, I think we need to go to lunch.